Okay, so hello and good evening once again. Lots of you know me already. My name is Dr. Dixie Constantini and I'm an obstetrician and gynecologist. So thank you so much for joining me for today's workshop. And the theme for today is 10 things to do right when trying to conceive. So we're going to take it in bits. If you have questions, I'm going to put a question tab out there after the workshop. You post all your questions below so that I can have enough time to address them as you put them below in comments. Okay, so you wonder if it is important to do certain things to your body when you're trying to conceive, just like you will prepare a farm, a field, when you are going to begin to sow some seeds, or you want to plant some fruits or plant some nuts. It's the same way that you have to take care of your body, prepare your body before pregnancy begins, because pregnancy is going to change every single system in your body. It's not true that you can just get up and get pregnant. Fine, there are some people who go through pregnancy without a problem, but most of the time it's really important for you to prepare your body before you get pregnant, just so that your pregnancy ends on a good note. Okay, so the first point we are going to talk about is checkup. Okay, before you get pregnant, it's important that you have three different types of checkup. The first one is an OBGYN checkup. This is important every single year. If you haven't seen your OBGYN for some time, it's important that you do get that checkup done before you begin trying to conceive. Okay, so when you go to your OBGYN, you have an ultrasound scan done to see if your womb, your ovaries, your fallopian tube, everything down there is okay. Then you have a pap smear done. It's very important for you to have a pap smear done before pregnancy begins, especially if you haven't had one within the last 3 years, because despite the fact that cancers are not very common during pregnancy, you can have cervical cancer during pregnancy, and it comes with lots of complications because of treatment, surgery, how to manage your pregnancy, etc. So a pap smear is very important as well when you go for your gynae checkup. Okay, so when you go for your gynae checkup, you're supposed to discuss with your OBGYN. Let your OBGYN know your history, if there are any new meds you're taking, if any new illnesses have come up in your history, or if there are any illnesses in your family that your OBGYN does not know about. Based on these things that you tell him or her, he or she is going to help you to plan your pregnancy. It's important because not everybody is the same. Every pregnancy is different, and history plays a big role, or it comes into play when you have to guide somebody through pregnancy. It's very important. Okay, so you have to find out as well if that OBGYN that you're going to is one that is good for you. There are different types of OBGYNs. Sorry about that. Some people are strictly into gynecology, whilst others do strictly pregnancy related issues like obstetrics. Some people also do obs and gynae, and those ones are the OBGYNs. Find out from whoever it is that you go to if they handle pregnancies as well. If they do not handle pregnancies, it's important sorry about that. If they do not handle pregnancies, it's important for you to change them and find somebody that can see you through your pregnancy journey. The fact that you're with someone, the fact that you are signed onto a particular doctor does not mean that you have to stay with them. You have a choice. It's your right to choose whoever it is that you feel is good for you when you are pregnant or when you are trying to conceive. You have the right to choose who takes care of you. Okay, so that's an interesting or an important thing you have to take note of as well. If you go to your OBGYN and you realize that you have some vaginal infections, or if you have had recurrent vaginal infections in the past couple of months, you let your OBGYN know as well, and this will be treated. This is important because once these vaginal infections or STDs, STIs are not treated, it can affect your fertility. Vaginal infections, especially the recurrent chronic vaginal infections, change the pH of your vagina, and it makes it difficult for the sperm to thrive there. If you don't deal with these things, pregnancy would be a problem. Despite the fact that your partner's sperm might be okay, you might be the problem because your environment down there is not conducive enough. So it's important for you to discuss this with your OBGYN as well and get it treated. So that's for the gynae aspect. You need to see a GP as well. And this GP checkup does not only have to do with you, you have to go with your partner. When you go to see a GP, your blood pressure needs to be checked. Your blood sugar needs to be checked. This applies to your partner as well. You have to check, have an ECG done if possible, and basically a general checkup, because if you have bad blood sugar, your risk of having recurrent miscarriages is very, very high. Even if you get pregnant, there's a higher chance that your baby, or whichever baby it is that you're going to have, would have some congenital defects, okay, birth defects that have to do with your bad blood sugar. This bad blood sugar also affects your pregnancy, such that it's you have gestational diabetes, or you have diabetes when you are pregnant. You have a higher risk of preeclampsia, etc., etc. When you check your blood pressure and your blood pressure is high, it's supposed to be managed as well, because once you have high blood pressure during pregnancy, it puts you at a very, very high risk level, such that the BP needs to be controlled before you get pregnant. And when you get pregnant, your meds might need to be changed, because not all BP meds are suitable for pregnancy. And because this high blood pressure before pregnancy puts you at a higher risk of preeclampsia, your pregnancy becomes high risk as well. So blood sugar needs to be maintained, blood pressure needs to be maintained. This applies to you and your partner. Okay, you have to do some labs. The labs need to check your full blood count, needs to check your hemoglobin, needs to check your blood clotting factors, needs to check how healthy your kidneys are, needs to check how healthy your heart is, needs to check your level of cholesterol as well. Because if you go into pregnancy, like I said, pregnancy affects every single system in the body. If you go into pregnancy and you have a bad kidney, or you have a bad heart, or you have very high cholesterol, it makes everything so complicated. Okay, when you're pregnant, your kidney works a little more than when you were not pregnant. So with a bad kidney, the stress that is going to put on your body is not something that we'd want to deal with during pregnancy. You might be able to carry your baby to term, but your kidneys might be so bad that you might need dialysis 3 times a week throughout your pregnancy, and you can imagine how expensive that is. If your heart is bad as well, you know that the volume of blood in your body increases significantly to cater for you and your baby. If your heart is weak, or your heart is not able to hold that pressure that is coming onto it, it's going to make your pregnancy a little complicated, or not a little complicated, very, very complicated. There are lots of cases where we have a heart attack on the delivery table, or a heart attack on the C-section table, and it's not a very, very nice thing that you'd want to experience. So please get your blood pressure checked as well, get your labs checked, make sure that they are okay. If your labs are not okay, discuss with your GP to know what it is that you have to do before you get pregnant, how long you can work on these lab results, so that you're able to you're able to go through pregnancy a little safer. Okay, there's no need to rush through pregnancy. Pregnancy is a very long journey. It looks nice on the outside, but it can be very complicated. Things can go bad very, very quickly. So if things are not okay with you health-wise, it's important for you to deal with that and then go on with the pregnancy if possible. Okay. Most of the men, most partners do not go to the hospital or do not go for yearly checkup. Usually women are more good at that. You know that you probably go to the hospital more often than your partner. So make sure that you pull this partner of yours with you to the GP if your partner is on any meds, or if you are on any meds that are not gynecology related. Discuss with your GP to know if it's okay for you to take it during pregnancy, or you would have to change these meds when you get pregnant or when you're trying to conceive. There are some meds that cause defects of your baby. There are some meds that reduce how much your body is able to absorb certain vitamins that you might be taking. There are some meds that reduce your partner's sperm health. All these things have to be discussed with your GP, so that before you get pregnant or when you are trying to conceive, you are put on meds that are okay, just in case you get pregnant before knowing it, so that your baby is not at risk. Okay. You also have to see a dentist. There are lots of people who do not see dentists, or who haven't been to a dentist in a very long time. Your dental health is important when it comes to pregnancy or trying to conceive. Once you have better dental health, or once your teeth on your mouth, the oral health is good, the pregnancy outcomes are a little better. People or women who have tooth decay or gum disease have a higher risk of preterm births and complications during pregnancy. And the pregnancy itself is a risk because it increases it increases your risk of getting like a tooth decay and stuff. So if you do not deal with this problem before you get pregnant, when you get pregnant, this is going to get worse and it's going to affect your pregnancy. Nobody wants to have a preterm baby, or it's better for you not to have a preterm baby, because if your preterm baby is very, very preterm, you might lose that baby, or you might have a baby with lots of defects postpartum, which no parent wants to experience. If you do have a preterm baby that survives it and it's healthy in the long run, you might spend so much time in NICU, and it's not something that is really pleasant. Okay, so see a dentist if you're trying to conceive. And during pregnancy, it is important for you to see a dentist as well, and it is important for you to see a GP as well. During pregnancy, you also have to have an ECG done, and a general check from your GP, and a dentist has to see you as well. Okay, so that's point number one. Point number two, your weight. There are many people who do not even bother to step on a scale, or haven't stepped on a scale in a very, very long time. It's important for you to make sure that your weight is optimal, or your weight is within the normal range per your height. Okay, you can find out this by calculating your BMI, which is your weight in kilograms divided by your height in meters squared. Just find out what your weight is, find out what your height is, and you can calculate this. If it is between 18 to 24, then you know that you are good to go. But if your weight is on the high side, you need to do something about it. Just a moment, please. Okay, sorry, if your weight is on the high side, you know that you need to do something about it, because once your BMI is above 24, it comes with so much risk during pregnancy. The higher your weight is, the higher your risk of preeclampsia. The higher your weight is, the higher your risk of high blood pressure in pregnancy, even if you don't have preeclampsia. The higher your weight is, the higher the risk of placental problems during pregnancy. The higher your weight is, the higher your risk of gestational diabetes during pregnancy. And even if you go through pregnancy without any complication, you are at a higher risk of having to go through a C-section. And when you have a C-section done, it's a little difficult because of the layers of fat that usually are in the abdominal area. You can see it yourself that maybe like your belly is a little fatty, and when you hold you pinch your belly, you would see the amount of fat in that area. Once we cut through the fat and suture, it heals a little like poorly because of the thickness of the fat layer. So if you can work on your body before pregnancy, try to lose some weight. It's important that you do. It will help you in the long run. Once you have a very, very high weight, it comes also with your risk of having a big baby, and you might have problems with your blood sugar, very bad blood sugar control, which can come with birth defects as well. So you work on your weight, try as much as possible, give yourself time to prepare for your pregnancy. There's no need to rush, like I said, no need to rush at all. Check your weight and make sure that your BMI is between 18 to 24 before you start your pregnancy journey. Okay. Point number 3, prenatal vitamins. It's a craze that many people will say when you are trying to get pregnant or when you're trying to conceive, you need only folic acid. Folic acid is very, very important, yes, for neural tube defects, for spina bifida, etc., etc. But every single pregnant woman is different, okay? The amount of folic acid that you would need is different from what somebody else would need. You might also need other minerals or vitamins during your pregnancy because of your health history. Okay, so based on your health history, you discuss with your OBGYN if you need only folic acid, if you need a little more folic acid than other people, or if you need to take specific prenatal vitamins as well. If you are relatively healthy without any health conditions, 400 micrograms of folic acid is usually okay. Lots of prenatal vitamins come with 400 micrograms of folic acid, meaning that when you take those ones, you do not have to take an extra dose or an extra tablet of folic acid, which lots of people do. They buy, for example, Pregnacare, and then they buy folic acid as well, which is a little too much for them because they do not have any underlying conditions that require an extra dose of folic acid. But if they do, that's a completely different story. So folic acid, 400 micrograms in your prenatal vitamins. If you have, for example, sickle cell disease, or if you are epileptic, or you are taking other meds that might reduce your body's ability to absorb folic acid, your OBGYN will let you know that you need to up your folic acid dose, just so that your baby gets enough the right dose that they need. Okay, so discuss with your OBGYN. Some of the OBGYNs are able to recommend certain prenatal vitamins, but usually they would just let you know that you can buy anything that you are comfortable with on the market, and it should be fine once it contains folic acid. So ask if your OBGYN thinks that you're okay. They'll just let you know to buy anything that you can find on the market. Okay, so you know that these prenatal vitamins are like vitamins or supplements that you need to take before pregnancy to prepare your body for your baby to be born healthy. Okay, sometimes they are also taken throughout the pregnancy journey, but these vitamins or for example folic acid is very important during the first 12 weeks of pregnancy, where all your baby's body parts are forming. Okay, once you do not have the correct dose of folic acid during that period, your baby's body parts, or some of your baby's body parts, might not form as they are supposed to. And once these do not form as they are supposed to, you might have a problem, or your baby might be born with a defect, or you might end up losing your baby through a miscarriage. Okay, there's certain things that you need to pay attention to when you are selecting a prenatal vitamin. Okay, like I said, your history. For example, if you have polycystic ovarian syndrome, you have to pay more attention to prenatal vitamins that have antioxidants in them. Inositol is a very good the prenatal vitamins that contain inositol are really good for women who have polycystic ovarian syndrome. So you watch out for that if you have polycystic ovarian syndrome and you're looking to conceive, you watch out for prenatal vitamins that do contain inositol. If you do not have polycystic ovarian syndrome and you're just planning on conceiving, it's important, like I said, to look for prenatal vitamins that contain the right amount of folic acid, which is 400 micrograms basic. Then you have to look for prenatal vitamins that contain the inositol. You'll see some with DHA, which is very important, especially during your third trimester, when your baby's brain is developing. It's really important for you to take prenatal vitamins that have or contain DHA, especially in your third trimester. This is DHA that you see written on the bottle of the prenatal vitamins. Also helps you as a mother or as a new mom to control your mood during pregnancy and postpartum. So it's a good choice to buy a prenatal vitamin that has DHA in it. Look for ones that contain vitamin B6, B12, vitamin C, vitamin D, vitamin E, some calcium, some iodine, if possible, some zinc. These are basic requirements, or these are little vitamins that and minerals that are really important when you're trying to conceive. Okay, it increases your chances of conception. Okay, so when do you need to start taking when you need to start taking your prenatal vitamins? You need to start taking prenatal vitamins at least 1 month before you begin to conceive, you begin trying to conceive. Okay, so at least your body has to have a 1 month store before you begin conceiving, or you begin trying for a baby. If you can do 3 months, fair enough, but it's important for you not to start before you have a 1 month supply of these prenatal vitamins in your body. Okay, so if just in case you are not able to hold these vitamins down, just discuss with your OBGYN as to how best you can get this into your system. If there are different types of these vitamins that you might tolerate a little better. There are so many on the market. Some are swallowable, some are chewable, some you can mix into a juice, like kind of a solution, and just gulp it down. So find out, buy what it is that you tolerate. It's not necessary for you to keep swallowing tablets or pills that you can't hold down. So if you cannot hold this down, talk to your OBGYN and get the type that you can hold down. Okay, there are some women who have a problem with a gene that we call MTHFR. Okay, these women have recurrent miscarriages, and these miscarriages go on until they are put on folic acid throughout their entire pregnancy. So if you are trying to conceive and you keep having miscarriages, find out from your OBGYN if this is your case. If you already taking folic acid and you still are having miscarriages, there are specific combination of meds that you need to be put on to hold the pregnancy. And it's very important for you to start working with a doctor you can trust before pregnancy starts, because once your pregnancy comes into play, or once you get a positive test, these meds are supposed to be started immediately to make sure that your baby stays, or to make sure that pregnancy holds. Okay, there are many people who say that it's not important for you to go to antenatal care, or it's not important for you to go to the hospital until you're like 6 months or 12 months. I don't know, 12 weeks, 3 months. They go to the hospital how they want, because there's a lot of bad information out there saying that it's not important for you to go early, but it actually is important for you to go early, especially if you have been trying for a long time. Going early allows your OBGYN to put you on the specific meds. Like I said, especially if you've had a couple of miscarriages, it allows your OBGYN to assess your risk, for example, of preeclampsia, because once you're given meds to prevent preeclampsia very early in pregnancy, before you turn 16 weeks, it reduces your risk of preeclampsia before 34 weeks significantly. So it's really, really important. And like I said, if you have an OBGYN, or if you have a doctor that is not taking care of you, or you do not like, please change them, because in the end, whatever happens to you and your pregnancy is yours to carry. You are the one who is going to take the blame. You are the one who is going to feel the pain. You are the one who is going to experience everything. Your doctor does not experience it with you. So change them, or find a good person who understands you, who will take you through your pregnancy. Okay. Do men also need prenatal vitamins? There are specific supplements for men that improves these supplements improves sperm quality. So if you and your partner are trying, you can also get supplements for men that they can or your partner can gulp down to improve his sperm quality and improve your chances of having or getting pregnant. Okay, so you can take your prenatal vitamins, and your partner might need some supplements as well to boost his semen quality. Okay. Point number 4. Food. When trying to conceive, it's important what you eat. It's important what you put in your body. It's important the places you go. It's important where you work. There are people who work in toxic environments that affect their babies. So you might not even know that you are pregnant, but the toxins around you might affect the developing embryo or the developing baby in your belly, and by the time you realize that you're pregnant, it's a little too late and you end up miscarrying. Okay, so toxins in your environment, very important. Protect yourself from smoke, protect yourself from these fumes in traffic if possible. Make sure you stay away from people who smoke. Make sure that you are not involving yourself in any recreational drugs if possible. Mind what you eat. Stay away from unpasteurized foods if possible. Eat healthy. Reduce your sugar intake. Reduce your carb intake. Stay away from junk food. Like basically go for healthy meals if possible. I know that there are so many times where you just come back from work, or you've had such a stressful day that you just want to have, like, you fill yourself with lots of junk, but it's difficult sometimes, but you know that you're doing this, or you know what it is that you're looking forward to, that baby that you've always been dreaming of, the baby that you're looking forward to. So cut out this junk food, eat healthy, and by eating healthy, you also help you don't gain so much weight, which would affect your pregnancy. Okay, so healthy eating, no junk food, reduce your sugar intake, stay away from people who smoke, don't smoke yourself if you do, stay away from toxic environments, don't do alcohol. If you are a coffee loving person, reduce your caffeine intake, or stay away from coffee completely, especially when you realize that you're pregnant. Okay, if you're taking very high doses of coffee, 3, 4, 5 cups of coffee a day, it reduces your chances of getting pregnant. This is the same as if you do lots of smoking. Okay, so increase your chances by reducing your caffeine intake, reducing your smoking, or staying away from smoking completely. So there are lots, like I said, there are lots of meds as well that can affect your baby. Stimulants, narcotics, stay away from all those ones to increase your chances of getting pregnant. Many people go into herbal therapy when they are trying to conceive, because apparently people tell them that okay, you can drink this herb and it's very good for you, you can put this herb in your vagina, it's good for you. But one thing you do not know, or one thing people do not know, is that people lie a lot. Lots of people would try these herbs, miscarry, or have very bad side effects from them, but would never tell you. They will tell you, okay, it's fine, go ahead with it, try it, and you will try it and experience very bad side effects. These people would not tell you how bad it can be, but if you listen to them use these herbs and it gets pretty bad for you, you are the one who is going to carry the consequence. Like I said, it's important for you to protect yourself when you're trying to get pregnant. Some of these herbs, or most of these herbs, we do not know the effect they have on pregnancy, and it's not a good idea, or there's no way we can do trial and error with pregnant women to see if maybe this herb A affects the baby, or this herb B affects the baby. It's not ethical. So what we advise is that you stay away from herbs if you're trying to get pregnant. Do go the right way, discuss with your OBGYN, work with your OBGYN so that your pregnancy ends on a good note. Herbs are not necessary. You need your prenatal vitamins, you need to eat well, you need to stay healthy, and that's supposed to be enough for you. You don't need any other herb, or you don't need herbal therapy. Okay. Point number 5, exercise. It's a big problem for lots of people to exercise these days because there's no time. People are always very tired and they'd rather just sleep than exercise. But exercising before you get pregnant, or exercising when you're trying to conceive, is extremely important. Okay, 1, the exercise improves your heart health. Like I said, if you have a bad heart and you go into pregnancy, it's not a good idea, because your pregnancy can end on a very bad note, and that is something that we do not want to deal with. Anybody who sees or who experiences a heart problem of a pregnant woman doesn't want to see it again, and it's not a pleasant thing for you as a pregnant woman to experience as well. So exercising increases or improves your heart health. It improves your lung health. It puts you in a better condition for pushing. Example, when you get to the end of your pregnancy, when you exercise, you have a better abdominal muscles, or stronger abdominal muscles, stronger pelvic floor muscles. You're able to push a bit better than somebody who does not have these muscles strengthened. And once you have these muscles strengthened, your body gets back in shape a bit better than someone who has a flabby or a big stomach before pregnancy. There are lots of people who postpartum complain that their belly is big and they want tummy trimmer, or they want a corset, which is a bit difficult to breathe in. I did try, because people were like saying these corsets are okay, you can like you should go for a corset and all. So I tried. I bought a corset for myself, and I did try to see how these women like survive in these corsets, and it's not a pleasant thing. I'd rather exercise than die in a corset. Okay, so exercise to strengthen your belly muscles. It makes your belly better or tighter when you're postpartum, and you're able to get in shape a bit better once you have your baby. You also recover from this pregnancy stress quicker than when you do not exercise. Okay, and if you don't exercise, or if you how do I put this? If you are not in very good shape, like I said, with the belly, if your belly is a little big and flabby before you go and have your baby, and you're not able to push, you end up in a C-section. C-section is a bit difficult on people who have very thick stomach fat, or thick lots of fat in their abdominal area. Sutures will fall apart, or can fall apart. They can get wound can get infected, and instead of you enjoying your baby, you might be going up and down to the hospital to try and going for dressing, to try and just make sure that that wound heals, because once that wound gets infected, it can actually kill you. So exercising exercise strengthen your abdominal muscles, strengthen your pelvic floor muscles, so that you can push. Once you're stronger, your chances of having a vaginal delivery are higher than if you are not strong enough and you're a little obese. Okay, once you're obese, or once you have a very sedentary lifestyle and you get pregnant, your risk of gestational diabetes, preeclampsia, like I mentioned before, are a little higher than those who are very active pre-pregnancy and even during pregnancy. The fact that you are pregnant does not mean that you cannot exercise. You have to discuss with your OBGYN as to if you're higher risk, medium risk, or low risk, what kind of exercises you can do. It's important not to go for exercises that are like you go running, playing football, somebody can kick you, you fall down, or go playing volleyball and you can fall. Any exercises that will increase your risk of falling are not recommended when you're pregnant. Okay, it's better for you to go for like pregnancy yoga, swimming, or just go for walks every day. Even going for walks every day pre-pregnancy, it's enough. It's better for you to do that than just try getting pregnant without having ever taken any walk. Don't walk alone, walk with your partner, because the men who at least exercise 3 to 5 times a week have better sperm quality. Okay, so the more the more your husband is active, the better his sperm quality. He shouldn't be like an exercise freak as well, because these exercise freaks they go overboard. Okay, we just need some activity in their life. They shouldn't have a sedentary lifestyle, just enough activity to keep them healthy, to keep them going. Okay, so exercise, and exercise with your partner as well to improve his heart health. Once you exercise, even sex becomes better for you, because you are able to take part. You're not always on the lower side where your partner is the one doing all the job, because you're always tired or you don't have that much energy. You can also work when you have fun with your partner, and your partner, he also has more stamina for like intimacy. Intimacy is more pleasurable. Okay, so exercise, very, very important. Okay, point number 6. Once pregnancy is all about sex, or you have to have sex to get pregnant. Okay, there are many people or many women who are just doing it wrong. They have sex like once or twice a month and expect that they will get pregnant. You can get pregnant, yes, but you might take a very long time, or it might take you a very long time for you to get pregnant when you're having sex once a month. It's not enough. So for those trying to conceive, it's important to know your cycle, know the length of your cycle, know when it is that you are ovulating. It's important. And work with your fertile window. It's important for you to use this fertile window, because usually the healthy sperm can stay for about 5 days. In rare instances, it can stay for about 7 days, and the egg is available for 12 to 24 hours. Okay, so if you're not using this fertile window, or if you do not know when to have sex, you might miss this egg, or you might have sex at a wrong time, where by the time the sperm gets to the egg will not be viable anymore. So it's important for you to have sex 5 days before your ovulation, and at least a day after ovulation. You know that ovulation doesn't happen every single like a month the same. It doesn't happen, for example, on day 14 every single month. It can happen at any the point in time during your fertile window. So it's important for you to make use of this window, and sex every other day is enough. Okay, if you want to go every day, that's your own choice, but every day is only advisable for people whose partners have normal sperm count. Okay, if your partner has normal sperm count and you're having sex every day, the sperm the count would reduce as you have sex on consecutive days, but the reduction is not significant enough to prevent you from getting pregnant. This is different for men who do not have normal sperm count. Okay, so if your partner has normal sperm count, you can do every day or every other day as advised, and it should work for you during your fertile window. You should be able to calculate your fertile window. You should know your cycle. You should map this cycle and know when you need to get your groove on every single month. Okay, everyone is different. Do what works for you. And when you're having sex during the period when you're trying to conceive, you try as much as possible to stay away from lubricants, because there are many lubricants that inhibit the motion of the sperm. It reduces your chances of getting pregnant. However, there are specific there are types of lubricants that improve motility, or are good for sperm motility, and help to nourish the sperm as they are deposited, to travel along a little bit longer than normal. These lubricants are available on the market, and they are more of motility gels that are just applied into the vagina right before intercourse to help increase your chances. Okay, so if you are trying, or if you think that you are a little too dry down there and you want to use a lubricant, it's better for you to go for a lubricant that is sperm friendly, or sort of a motility gel. This is better for you. If you find that, fine. If you do not find any of that, you can also always ask your gynae to refer you, or to let you know what it is that you have on the market, so that you go for those to improve your chances. No oils, no butter, no saliva. Just stay away from these things, because these things are not something that you need in your vagina when you're trying to conceive. It's not healthy for your vagina, and it's not healthy for your partner's sperm as well. Okay. I spoke about vaginal infections, how you're supposed to treat them, because once they're not treated, your vaginal environment changes, and it reduces your chances of getting pregnant. Okay, so treat vaginal infections, treat STDs if you have any, and enjoy yourself when you're trying to conceive. Don't put too much stress on, for example, following your ovulation using the test strips, and you might miss your ovulation when you're using the test strips. It's better for you to just go free range, use the fertile window every other day, and just enjoy yourself. Less stress and higher chances of you conceiving. Okay. Point number 7. It's important that when you are trying to conceive, you come with together with your partner and plan. Sometimes you might get pregnant in 3 months, you might get pregnant in 6 months, you might get pregnant in 1 year, in 2 years, but there are other times that you might need a little bit of help from your doctor, and this can be expensive. So when you plan for your pregnancy, you save up for your pregnancy, and these hitches come up, you're able to at least dish out some of the money that you already put down just for these trying times, and it makes it a little better to tolerate for you and your partner. Stress is not something that we need when you're trying to conceive, and I'm going to talk about that in a moment. Okay, so you have to start saving up, save as much as possible when you're trying to conceive. Talk to your partner as to what it is that you would want when you get pregnant, what it is that you would need that you get when you get pregnant, how you're going to cope with the baby. I know there are lots of things that are going to change, but it's important that you discuss all these things and at least get a fair idea as to whether both of you are ready to have a baby or not, because sometimes it's all lovey-dovey until the baby comes in, and once the baby comes in, everything just falls apart. So plan as much as possible, save up as much as possible, and talk to your partner. Discuss any genetic issues in the family. You need to know your genotype, if it's compatible with your partner's genotype. You need to know if for example, there are certain conditions that run in your partner's family line, or your partner needs to know as well if there are any conditions that run in your family line, such that, for example, all female children would have a certain condition, or all male children will have a certain condition. That way you would know to inform your doctor about it, to go for genetic testing when you realize that you're pregnant, etc., etc. All these things are important, because once they are put in place and these, like I said, these hitches come up, you're able to handle them a little better. You know exactly what it is that you have to do, where it is that you have to go. It's expensive to get pregnant, or it's expensive to go through pregnancy. It's expensive to have a child. So if you do not have a store of cash, for example, if you do not have a store of emotions, or if you do not have, like, if you're not prepared to go on this journey, it can really, really hit you hard. It's your child, it's your pregnancy. Nobody's responsible to take care of you. It's your own responsibility. If you think you can have a child and you can handle it, you can take care of your own child, fair enough. But you have to be ready to deal with the hardships with your partner. Okay, somebody is asking for this lubricant. I have some samples here that I'll show you quickly before I move to the next step. Okay, so this is I have 2 samples that these pharma reps gave me. So this is one that has like a metal fatty gel. You can see the sperm moving there. This is another one that they usually write motility gel on it, so you can see like that it's specifically for that. Both of them look the same, sort of. It's comes with an applicator where you break this part and then you press it. So before you do your stuff, let's see. So before you do your stuff, you break the tip of your gel into your vagina, apply, and you can have fun. Okay, it's just a tube of 5 mils. Just apply it in there, and that should be fine. So there are different types of motility gels on the market that you can find yourself. I don't know which ones are on the Ghanaian market, but it shouldn't be a problem to ask your OBGYN to help you out with motility gels. Okay. Point number 8. You know that pregnancy comes with stress. Okay, it's a beautiful story when people tell you that they just tried for 1 month and it worked out for them. They tried for 2 months, it worked out for them. But there are lots and lots of people who try for many months before pregnancy happens for them. So before you get pregnant, it's important that you cut down on your stress before the stress that comes with pregnancy arrives. Okay, and do as much as possible to reduce that stress, because once your body feels that it's in a stressful situation, it gives negative feedback that this is not the time for a baby to arrive. Stress would affect or can affect your menstrual cycle. Stress can affect ovulation. If you are stressed during pregnancy, the stress, your baby does feel this stress and anxiety. And these babies that are born to very stressed mothers usually have behavioral problems as well. They usually aren't that calm, or they are a little more active than normal. So cut down on the stress. If there are people in your life that you know cause you lots of stress, stay away from them if possible. Find hobbies for yourself. Go walking, travel if possible, enjoy life with your partner. You need to handle stress a bit better. You need to deal with stress before you get pregnant. Reducing your stress levels will increase your risk of improve your pregnancy chances. Okay, if you have any trauma in the past, for example, there are some women who have been molested or abused in the past, and if you need to deal with it before you get pregnant, it's important that you do deal with this. It's important that you talk to somebody, a psychologist, to deal with this trauma before you get pregnant, because there are many cases where these women do not even tell their partners that they have been molested or they have been raped, and once they come to the delivery ward and they meet a male doctor there, or they meet a male midwife there, and the male midwife is supposed to do a vaginal examination, hell breaks loose, and that is when this comes out. Okay, deal with your stress. Talk to your partner if there are any hidden stresses, or if there's anything that your partner needs to know before this time comes. You need to tell him. You need to be open to your partner so that he knows what exactly to do to help you during this stressful period. Pregnancy can make you anxious sometimes. Some people go through pregnancy and the whole of the 40 weeks they are extremely stressed, extremely anxious. Nobody can tell you beforehand if your pregnancy is going to be a good one or not. So if you have the chance at least to improve your pregnancy outcomes, it's important that you work on that before you get pregnant. Okay, work on your stress. Try to sleep as much as possible. At least if you can get like 6 to 8 hours of sleep every night, it's important. It's not necessary for you to stay up all night to watch movies and stuff. You can enjoy your day and try to head to bed a little earlier to reduce your stress level. Sort of when you sleep better, it's better for your body. Plus, once your baby comes, or even before you get to your 3rd trimester, sleep might be very scarce for you. It might be very, very difficult for you to sleep. So stock up on the sleep that you need, so that when the time comes for you to stay up for your baby, or stay up just because you cannot sleep, you'll be able to tolerate it a bit more. Okay. Point number 9, you need to be very, very informed when you are trying to conceive. There's lots of bad information out there. There are lots of for example, Facebook groups and lots of things on Google that people write that are not true. Make sure that even if you read anything, you consult your doctor who is going to take care of you. Find out if this information is true before you let it sink in. Don't trust people who tell you everything is fine, or I tried and I waited for like 5 years and God showed up. Fine, there are lots of miracles out there, but you cannot believe what people tell you. Stay informed. If you are trying for a long time, if you are below 35 years of age and you have been trying for 1 year, it's unnecessary for you to stay at home and wait for 2 years, wait for 3 years, wait for 4, wait for 5, because the older you are, the lower your chances of pregnancy, even if you go for an IVF. If you are above 35 years of age and you try for 6 months, 6 months is enough time for you to get pregnant, okay? So once you get to, you try for 6 months, after 6 months, it's important for you to let your OBGYN know that you've been trying for 6 months, for them to help you. Maybe they would ask for some lab works to see if your hormones are okay. Maybe they would say that, okay, let's just forget about the lab works for now and do a clomid stimulation to see if it'll work. And it's so much goes into trying to get somebody pregnant. So once you try and it doesn't work within this time range, it's important that you get help. Don't listen to people. Don't listen to those people who say that just wait, God to show up for you, because there are many of them who actually will tell people that they should wait and everything will be fine. But they are actually not waiting. They go behind, go to see a doctor in secret, have their IVF and come out to testify how God showed up for them after 25 years. But that's a baby from an IVF. That's a in vitro fertilization. The baby was made and implanted in their womb because there were so many factors that prevented them from getting pregnant. But you know how the society is, that looks at IVF mothers as weird, or IVF babies as not good enough. So these mothers or these women hide this information and encourage other people not to seek help, even though they are seeking help themselves. So don't listen to people. Read as much as possible and ask questions from the right sources to make sure that you have the right information. If you need any vaccinations, it's important that you get them before you get pregnant. Discuss with your OBGYN. They'll let you know what kind of vaccinations that you might need, depending on the area that you live in, depending on the country that you live in, and if you can get those before you get pregnant, or if some of them are tolerable during pregnancy. It's important. Whenever you go to the hospital, or before you go to the hospital, you need to write down the questions that you want to ask. There are some doctors who do not like to ask questions. If you notice, they do not like to answer questions, or they do not like to be asked many questions. What they say is final. But every single doctor knows that that is not how it works. A doctor is there for the patient. A doctor is there to respond to the questions of the patient. A doctor is there to make sure that the patient is informed. So if you have a list of questions that you're asking your doctor, and this doctor is not providing you with the answers, or this doctor is not giving you any positive feedback, it's about time you changed them before pregnancy arrives. Because once you cannot trust somebody to take you to pregnancy, it's not beneficial. It's not advisable for you to stick with them. The better your OBGYN is, or the better the person who is caring for you through pregnancy is, the higher your likelihood of having a successful pregnancy, or the higher the chances of your pregnancy ending on a good note. Okay, don't settle for anything less than perfect for yourself. You are paying for the service, or you are insured for the service, and demands that you have the best care possible. Okay. The point number 10, we have different health histories. As soon as you get pregnant, there are a lot of people who say, okay, let me just wait for a little while and see if pregnancy will hold. Like I said in one of the points before, as soon as you get pregnant, you let your OBGYN know. If pregnancy is around 4 weeks, something will be seen in the womb, even though it will be very tiny. Labs can confirm how high your pregnancy, how high pregnancy hormone levels are, and based on how high these levels are, your OBGYN will tell you if this pregnancy is going well, if this pregnancy is looks suspicious, or if there's something else that he or she needs to do for you to make sure that it ends well. Okay, so immediately you get pregnant, head to the doctor's office, confirm pregnancy, confirm location of pregnancy, which is very important, because once your pregnancy hormones are high and nothing is seen in your womb, there's 99 or even 100% chance that you do have an ectopic pregnancy, which is life-threatening and has to be dealt with. Okay, positive pregnancy test, go to the hospital as soon as you can. Go to the hospital immediately. If you can, join a pregnancy support group. Even before you get pregnant, join a support group that at least reduces your stress level. You hear positive feedback from them, but not positive feedback that tells you to ignore your doctor's what your doctor is telling you, or go for herbal therapy instead, or do certain strange things. Positive feedback that makes you know that you're okay, that makes you know that you will be fine, that makes you like know that despite the fact that things are not working out, if you work with your doctor, or if you keep believing, everything is going to be okay. Believe, but work with your doctor to make sure that outcomes are okay. Okay, when you get pregnant, join a pregnancy support group if you can. Okay, join a pregnancy support group that keeps you informed. There are lots of times that you'd have many things running through your mind. You do not know who to ask, but you see lots of people writing many strange things on Facebook, and thousands of people write, give them responses, many of which are wrong. You do not know what to you don't know which one to take. Join a pregnancy support group. Find a good hospital that will take good care of you. Find a good midwife to take care of you if you can. If you have the chance to choose between a midwife and an OBGYN, always go for an OBGYN. Midwives are amazing. Yes, they usually deal with non-complicated pregnancies, but like I said, nobody can tell you how your pregnancy is going to end. Pregnancy, or someone might have a very beautiful pregnancy journey right now, and in the next second, it's everything goes haywire. So go for an OBGYN who is trained to handle pregnancy complications, who has like a third eye to see if things would go wrong or not. A good OBGYN is always able to sense if there's something that needs to be done. If you go to a midwife who is not trained to handle complications, because usually midwives are trained to handle normal births, physiological pregnancies, you might find yourself in trouble. So please make that good choice. Go for an OBGYN if you can, instead of a midwife. If you do not have any other option but to work with a midwife, just to keep your eyes open, like I said, join a pregnancy support group. If you think that there's something wrong, run as quickly as possible to a different place that can help you. Don't deliver in a midwife's clinic. Always go to a big hospital that has an OR or an operating room that can deal with any complications that come through, and trust your gynae. Like I said, if you do not trust them, change them, because everything depends on how good your gynae is. Your pregnancy journey is important. As much as you would have been trying for a very long time through all these miscarriages, for example, you need somebody to take you through pregnancy to make sure that it ends on a good note. So these are the 10 things that you really need to pay attention to when you are trying to conceive, and when pregnancy happens for you, what you need to pay attention to. I hope that this whatever it is that I've said during this time has been beneficial. I'm going to put a question box out there. If you have any questions, please do leave them in the comments below in the question area, and I will respond to all the questions that come in. Thank you so much for joining me on this workshop. I hope it has been beneficial. All feedback will be very much appreciated. If you enjoyed it, let me know. If you didn't like it, let me know. If there's anything that you think that I need to change, let me know. I would very much appreciate it. Thank you so much once again, and have a good evening. Bye bye.